Hello and welcome to our special show, Fighting COVID with Dr. Randeep Guleria. I'm Gargi Rawat. This is the show where we run you through all the pandemic developments, all the news developments, all the vaccine developments over the last week. Thank you so much, Dr. Guleria, for joining us on the show. Now, first and foremost, over the last week, there's been a lot of talk about the Delta variant and how it's more infectious. There have been, studies released in the UK and the US is also concerned about it. We still don't know if it causes worse disease, but the topmost question that many want to know is whether the vaccines that we have are effective enough or efficacious enough against this variant.
So you're right. What has really been a cause of concern now is this Delta variant. And there is data which suggests that possibly it did contribute to the huge surge that we saw as far as the second wave was concerned, and therefore maybe a highly infectious variant in terms of the virus itself. The vaccine efficacy data is emerging, and what it does suggest is we're looking at two things. One is protection against infection, and the other is protection against severe disease. The data that is emerging does seem to suggest that the vaccine protects us against the Delta variant causing a severe disease, and that has been seen in small studies done in India and also data from the ICMR, which suggests that the vaccines are effective in preventing severe disease. But we may still continue to have infection. That is, people may still become COVID positive because of the Delta variant. And that is why COVID appropriate behavior continues to be an important strategy till such time that we are able to come out significantly from this pandemic and have a significant decrease in the number of cases.
That's right, especially as we're opening up. It doesn't mean that this, the infection has disappeared or the virus has disappeared. And especially since it's this more infectious one, we need to keep emphasizing that people have to continue following the protocols.
Correct. You see, the issue is, why do we see these waves? The reason why we see these waves is basically two things. One is, of course, the mutation which the virus has. The virus mutates because it wants to continue to infect more and more people. So it becomes more infectious. It starts trying to spread more rapidly. The second reason why we see the waves happening is that once the cases come down and we reach a plateau or we reach a nadir that we feel now the cases are less, there is a decrease in COVID appropriate behavior. People start again having crowds, having social functions, and stop wearing masks and things like that. And this allows the virus again to spread in susceptible population. So until we reach a phase where we can say, yes, a large number of Indians have been vaccinated and we are protected and we could break the chain of transmission, I think we have to be very aggressive in having COVID appropriate behavior, in having very good surveillance, and continue to be aggressive in testing, because that will help us in picking up any hotspot and also making sure that even if a new variant occurs, we will be able to prevent it from spreading as we saw in the second wave.
Right, Dr. Guleria, so this brings me to my next question, which is about breakthrough infections. What do we know so far about breakthrough infections? I believe there is a study going on. What information do we have? Is the Delta variant being identified more in these breakthrough infections?
So breakthrough infections are being reported. The current data is limited, so we can't really say how common it is. Data initially from ICMR suggested that breakthrough infection was less. It's not that much of a problem, but it is still there. And the issue is that with new variants like the Delta variants, is this going to become more and more common? Because that has implications both in terms of the protected population and the strategy that we need to have in place. Current data suggests...
So I just want to, tell our viewers when, you and I, of course, know what breakthrough infections is because, of course, I've been reporting on this. But breakthrough infections is when somebody gets coronavirus illness even after receiving both doses of the vaccine. And this is something that a lot of people are talking about. So sorry for that. Do continue.
Yes. So breakthrough infection is basically if you get the infection after you've been vaccinated. It could happen after the first dose or after the second dose and 2 weeks after the second dose, when we would say that you should be protected with good amount of neutralizing antibodies. So like I had said in the beginning, we can really see breakthrough infection happening. And like what we are seeing is that breakthrough infections can happen. But our concern is that you may get infected, but you should not get severe disease. The vaccine should still protect you from severe disease, even if you get breakthrough infection. And that data seems to be emerging that by and large, the vaccine is holding out in terms of preventing severe breakthrough infections.
All right, but we are studying it. And my next question is the long gap between doses of the vaccine safe? Does our immunity, start to wane? Are we more vulnerable? That is a big worry as well.
So that is true. From the Covaxin point of view, it's not a concern because the dose schedule has not changed. There has been a change as far as Covishield is concerned. And when this data was there in February, March, it was based on the variants that were circulating, and it was shown that 12 weeks is good enough. Now, there is some data which suggests that we may need to relook at it from the point of view of whether the duration may predispose people to getting breakthrough infection after the first shot with the Delta variant. I think this was being looked at by the various expert groups. So hopefully we should get some idea. As of now, there is no change, and we should, as far as Covishield is concerned, the second shot is after 12 weeks.
Right, because we do know it's been said that, the UK has reduced that gap between the two doses of Covishield, which is AstraZeneca vaccine over there. And it's because of the Delta variant becoming more dominant in the UK. And so they felt it was risky to have such a big gap between doses. So as you're saying, this is being studied, all this is being looked at by, the Indian authorities as well. Is there any rethink? Will we possibly see another announcement about possibly reducing the gap between the Covishield doses?
So you see, currently our knowledge as far as not only vaccine but even the COVID infection is evolving. If you remember, 1 year ago we started off with hydroxychloroquine, certain other drugs which we've moved away from, and now we're looking at newer drugs and newer molecules. Same is the situation with vaccine. We started off looking at how we should give the vaccines, 4 weeks, 6 weeks, it went up to 8 weeks, then we went up to 12 weeks. So I think as new data emerges, we have to really look at it from the science point of view and the data point of view, and therefore recalibrate our strategy from that point of view. So it's possible that we may again look at it and take a decision in terms of what should be the ideal timing between the first and second shot as far as Covishield is concerned.
Now, doctor, something that is also emerging is that many patients who recover after COVID are falling ill again. Why is that? Suddenly they're back in hospital. If they're in the COVID ward and it seems they're recovering, suddenly they're back in the ICU. What is the explanation for this?
So you're right. There is a little change that we're observing between the first and the second wave. And in the patients who have had COVID now in the second wave, we are seeing some patients who recover and then a few weeks later have fever again, come back with fever, or some of them have even fall in their oxygen saturation and are requiring admission. This was something we were not seeing that frequently in after the first wave and people who are recovering after the first wave. It's something that we need to look at. My own feeling is that this could be linked to the ongoing inflammation being more sustained in the current population. There is a need to study this. Because two things are different from what we saw in the first wave. First thing that is different is, of course, the fact that there is a new variant and it may be presenting and behaving in a different manner. And the second thing which you also need to see is that now many people have been vaccinated, and whether the combination of vaccine and the infection is causing some ongoing immune response which is lasting for a longer period of time. But we are seeing patients this time who are going home and then coming back with fever, which persists for a few weeks and their markers go up, and some even have a fall in oxygen saturation.
Right, Dr.
So there is a slight difference in how the virus or the infection is behaving this time than as compared to what we saw in the first wave, which is something which a lot of people are actually evaluating and studying.
All right, there these cases of intestinal gangrene being reported. I'm also seeing this time around a lot of cases of hearing loss. We were speaking to doctors and they said a lot of patients are coming back with hearing loss.
So these are what we call long-term sequelae which may happen, and sometimes clotting continues for a longer period of time, and that is, like I said, we're learning more and more about this virus and whether in the long term we need to continue. Some low dose blood thinners in some patients is also something that is being evaluated and being given. So there are patients who recover and become all right and then still continue to have some symptoms. So I think it's important for us to understand that COVID-19 is not like a simple pneumonia that you recover and you're all right and you can go back. It may have some long ongoing symptoms, and that is why it's important to continue and evaluate people even after they've recovered from COVID for some time, because some of them may continue to have symptoms even later on.
And how long should one monitor once you've recovered from COVID or your loved one has recovered from COVID? How long should one, continue to be alert to any sort of changes in health?
So normally what we see is COVID usually symptoms last for about 4 weeks and you come out of it by the fourth week. The subacute phase may last for up to 12 weeks, that is up to 3 months. Most patients may have some symptoms which are usually up to 6 to 8 weeks. And occasionally some may come up to 12 weeks. And then there are some who go to the long COVID, which is after 12 weeks.
Now, Doctor, there's also been recent reports of how health experts have advised the government or have said that, unplanned vaccinations can promote mutant strains. What does this mean? It was a report that said, a group of public health experts and doctors from AIIMS, in fact, have said that, instead of this indiscriminate sort of vaccinations, we should go in for more for vaccinating those who are at higher risk.
So whenever you have limited vaccine, there are two parts in this. One is whenever you have vaccines which are in limited supply, you have to prioritize. And that was what was done initially, that you prioritize the vaccine doses for those who are at highest risk of having severe infection. And those are the elderly and those with comorbidities. Also, then you would, if you're able to vaccinate them, then you bring down your priority list so that it's done in a systematic manner. If it is done in a manner where you are vaccinating people and not able to complete your doses, you may have an issue of incomplete vaccination, which may be a cause of concern. That's why it's important that those who have got the first shot should go ahead and get the second shot. And those who are especially having comorbidities should come forward and get themselves vaccinated. There have been studies which have shown that sometimes if your immunity is low, especially those who are having, let's say, are on chronic dialysis or those who are on regular chemotherapy, if they get COVID infection, the virus may stay in them for a long time, may continue to replicate, and that may lead to the emergence of mutant strains. So that is why those individuals whose immunity is low, those who have comorbidities, should be prioritized first to get the vaccine.
All right. The next question is, why are we seeing this backlog in COVID death numbers from states? We just had Bihar announce nearly 4,000 cases, 4,000 deaths after they reviewed the numbers. Maharashtra too has been recalibrating the death numbers.
So there is a need for all hospitals, states and institutions to do a death audit, because often what happens is when you start listing the cause of death, you may say that this person died, let's say, of a heart attack, but he may be COVID positive and the COVID itself may have caused the heart attack. So you may have misclassified this as a non-COVID death because of a cardiac problem rather than that because it directly being linked to COVID. So there is a need for audits to be done, because sometimes the data which is fed in initially may be more towards trying to look at the cases in a different manner, and they may be underreported, because very often the cause of death has to be clear and it has to be seen whether this could have been caused by the infection per se rather than just let's say a heart attack, which would otherwise have been labeled as non-COVID.
Right, and experts have been pointing this out for a long time, questioning the death figures from certain states. And if you could just tell the viewers why it's so important that we have a clear, the clear numbers and also know the clear situation on the ground.
So this is very important, because we have to know what are the causes of mortality, what can we do to bring down our death rate. So unless we're able to have clear data in terms of how many people died of COVID, what did they die due to? Did they die due to pneumonia? Did they die due to COVID causing heart attack? Did they die because of COVID causing subsequent complications occurring in a COVID positive patient like secondary infection or even other things? We will not be able to develop a strategy to decrease our mortality. So it's very important that both in terms of developing a strategy to prevent subsequent cases and to decrease our mortality, we are able to assess why are people dying, what is the cause, and how is it linked to COVID, and what can we do to prevent that from happening as far as the COVID is concerned and the cause of death is concerned.
All right, with that, time for us to slip into a short break, but we'll return with more questions for Dr. Guleria. We're going to ask him about this new treatment, monoclonal antibodies, and is it a game changer? Welcome back to our special show, Fighting COVID, with Dr. Randeep Guleria. And I want to ask you about this new treatment that has come into India in the last couple of weeks, the monoclonal antibody treatment, which some doctors are describing as a game changer. What's your view?
So monoclonal antibodies, whatever data there is very encouraging. But there are 2 or 3 things that we need to keep in mind. One is that this is only for people with mild to moderate disease and those who are not hospitalized. So those who are hospitalized, who are on oxygen and who need others treatment, the data does not support that this treatment has had any effect. As a matter of fact, the data in the studies was negative rather than positive. The other thing is that this is a drug which has to be given either through the intravenous route or the subcutaneous route. But in those people who have mild illness and who have comorbidities which may predispose them to a serious illness because of the comorbidities, this has been found to be effective. So in the elderly, those who have comorbidities like diabetes, chronic heart disease, kidney disease, giving this early when you are diagnosed to be COVID in the first few days may actually prevent the virus from progressing forward and the disease from progressing forward, and may help to save lives in terms of these individuals going on to severe disease requiring hospitalization. The challenge is that, first of all, this has to be given in a hospital setting.
Right.
It's not a pill that you can say you take at home. You have to come to the hospital either for the subcutaneous injection or the intravenous injection. So it has to be in like a daycare setting. You come in, you take it and you go back. And so that needs to be built in because that was not something which was being done in the past. Secondly, is the cost of the treatment. The treatment is relatively costly, and therefore rolling it out for everyone in an equitable manner is also going to be a challenging thing. However, having said that, it is something which will be an important treatment strategy in our armamentarium as we go along in terms of treating those who have high risk of developing a severe COVID illness.
All right. So it is something that is promising. It has to be given early, though, and those who are in danger of, getting a more serious disease. Yes, 59,000 rupees for a dose is very expensive. Hopefully, it will become cheaper in days to come. The next question is COVID illness causing diabetes? And what should patients do? Monitor their sugar post recovering from COVID?
So there are 2 things. One is that because of the fact that a lot of drugs are given in patients which can lead to your sugar going up, including steroids, people get high blood sugar because of that treatment. Also, COVID infection we know can also affect the pancreas and therefore also cause some degree of high blood sugar happening. And therefore, I think it's important that people who have COVID should monitor their blood sugars. The third important thing is that many people in our country don't even know that they have diabetes. And when they get COVID and get all their tests done, then they suddenly realize that their blood sugars are high. So I think it's important that people get themselves evaluated for diabetes even before and get their sugars controlled, because like we've been saying, diabetes along with COVID can lead to more serious illness. And if your sugars are high, then post-COVID also you should continue to monitor them and continue your treatment. You may come out of it and one may be able to stop the treatment in some individuals, but some may need to take treatment because they may have underlying diabetes which was not diagnosed before they were diagnosed to have COVID.
Right, and we do know diabetes is a ticking time bomb in India, and as you said, most people don't even realize that they're pre-diabetic. The last question, doctor, what antibodies tests should one get done? Because now everybody's either had COVID or had the vaccine, and everybody's very interested about their antibody levels. And there are different types of tests. There's a spike test, there's the antibodies test. If you could just tell the viewers.
So there are a lot of antibody tests which have come into the market. Some looking at neutralizing antibodies, some looking at antibodies against the spike protein. But I think it's very important for us to understand because this is creating a lot of confusion in the general public. And I have people sort of even ringing me up and saying, my antibodies have not developed. Should I take another shot of the vaccine? So it's important to understand that when we look at the protection that one gets, it is not only about the antibodies, it's also about the cell-mediated immunity. It's also about the immunity that you get by the T cells, which also, even if your antibodies are low, these cells have the memory to remember the virus. And if you get the infection, they start producing antibodies whenever you get the infection. Therefore, just looking at the antibodies or looking at the antibody titer is not really a good way to see how well you are protected.
So it's not giving you a clear picture, because people are comparing antibodies, getting very worried if they have less than, somebody they know. So you're saying it doesn't give you a clear picture.
So I would just say that don't get into this looking at your antibodies, because there are people who get their antibodies done every 2 weeks and start plotting it and then getting worried that are they coming down and what should we do. I would really say if you have got the vaccine or if you got COVID infection, the infection will give you good long-lasting immunity, and which is more than what the antibodies levels will tell you.
All right. So very important clarification there about this antibodies test. And as you said, yes, so many people are getting it done, every couple of weeks to check their antibody levels. Thank you so much, Dr. Randeep Guleria, for joining us here on NDTV and answering all those questions.